Moving on now to a question from Michael Maclennan.
We're launching COVID Aid this month, say national UK charity. We've recognised that people affected by COVID-19 will require support, not just now, but in the months and years to come. What do you think are the most concerning long-term effects of COVID?
I think it's a fantastic idea, and congratulations on setting up this organisation. It is fantastic that you've set it up. I really sincerely hope that the government help you with grants and you get local grants, because this is it. We don't know at the moment still what the long-term, social, economic, mental and health consequences of COVID will be. With the evidence on long COVID, the evidence is coming in all the time. My colleague Anthony spoke about how long COVID has affected young children. And we know that, we know that 7 to 8% of children have long COVID at 5 weeks, actually 13 to 15%, I think, or 12 to 15% of teenagers have it around, 3 months later. We don't know what the long-term consequences are, and certainly in terms of social and economic consequences, there will be lots of decisions there. So hopefully you will get more grants from the government, and hopefully the government themselves will be looking at this issue post-COVID as well.
Good to hear about the charity, Michael. And I'm wondering what the brief and the role of the charity is, whether it goes beyond helping individuals, because obviously in the future, a key thing is going to be learning the lessons of under-resourcing and under-investment in key bits of our society, especially the National Health Service. We see the huge and accumulating backlog and people on waiting lists, but also the public health infrastructure, which has been really diminished over the last decade, and we're unfortunately reaping the results of that. The other big issue is the increasing inequalities that's happened as a result of pandemic. And so I think there's some of these broader structural issues that are going to be really important in terms of helping people in the short term and in the long term, and ensuring that come the next pandemic, because unfortunately, it's not a question of whether, it's a question of when. That's what we all said in 2009 after the H1N1 pandemic. Putting the whole society into a more resilient position. And that requires individuals working with community networks and organisations and putting pressure on those with the power and influence to change some of these more fundamental issues.
The point I was going to raise is very much aligned with what Susan raised, which I appreciate. I think the really critical thing that we've learned, I really applaud your initiative. The really critical thing we've learned is that in the middle of an emergency is perhaps not the best time to start initiating engagement or to try to build trust. And so whilst we have had to do that in the middle of this emergency, it's really important that initiatives like yours are really looking to sustain this engagement and build that trust as part of community participation. So I think that's really, really critical, that that sustained impact, the sustained engagement, and that building trust, and that to actually design our preparedness for the future. So one of the things I've said before is, if we're going to rethink the exercises that and simulation exercises we've done in the past, could we rethink it in a way that actually engages community representatives, members of the public, or organizations like yours as part of preparedness for future emergencies? So I think that's really that long tail of what emerges from this pandemic is going to be really critical.
Thank you very much, Tallulah. Thank you for your question, Michael, and good luck with the charity. Thank you for coming along today.